Hi, everyone. I hope everyone had a nice lunch. My name is Alejandra. I'm a senior at San Domenico School at Marin County, and I'm an AIM Youth Ambassador. I'm here to welcome back to the stage Dr. John Piacentini and Dr. Ramona Friedman. Dr. Piacentini is a board-certified clinical child and adolescent psychologist and professor in the UCLA Department of Psychiatry and Biobehavioral Sciences. Dr. Piacentini's research focuses on the development and testing of effective treatment for youth OCD, anxiety, tics, and body-focused repetitive disorders. Dr. Friedman has extensive experience in providing cognitive behavioral therapies for anxiety disorders, life stress, insomnia, and body-focused repetitive behaviors. She has specialty training in the treatment of childhood anxiety and related disorders and applied state-of-the-art science into her clinical practice. Please join me in welcoming back Drs. Piacentini and Dr. Friedman.
So, thanks for having us back. All right, we're going to be having a discussion with each other. We were hoping for some stools.
Yeah, and I don't want to see, I think I've had Elmo shake like every time I've been up here, so I'm going to really try my best. Poor Elmo looks like his arms and legs are about ready to fall off. Okay.
Dr. Piacentini, the word anxiety is used a lot, and it's used to describe a lot of different kind of manifestations of anxiety. Can you tell us a little bit about like the different types, or how do you see anxiety present?
Yeah, that's a great question. So we use anxiety, and as you've heard at various points over the morning, anxiety is completely normal. It's part of our natural system to keep us safe. I call it nature's car alarm in some ways because it warns us of bad things. So anxiety is normal. Some people are a little more anxious, but it's not a big deal. Some people are really anxious, but it's not clinical, and some people have clinical anxiety. So it really is a whole broad continuum, depending on the impact and the distress associated with it. But when we think of anxiety, the anxiety response, we can break it down into 3 channels. It's called the tripartite model of anxiety. The first is thoughts, anxious thoughts or worries. Something bad is going to happen. I'm not prepared. I'm going to make a fool out of myself. Kids are going to laugh at me. I'm going to have a panic attack. These are the worry thoughts. The physical sensations are, heart beating faster, feeling sweaty, feeling like we're going to pass out. All the kind of the physical symptoms of excessive arousal. And then the third channel is the behavioral component. And the behavioral component can range from crying, asking for reassurance, tantruming, melting down, or avoidance, running away and trying to avoid the situation. We also think obviously about the emotional response of just feeling anxious, but that oftentimes fits better under the physical symptoms piece of it.
Mm-hmm. I find that sometimes you don't even actually see the anxiety, especially in those that are high achievers. So like those perfectionists, they seem to be, everything is put together well, and they seem to be getting straight A's, and they don't really seem anxious. Is that common?
Yeah, a lot of times when you're feeling anxious, or when we're feeling anxious, we can camouflage it pretty well. And even some people with pretty severe anxiety are able to maintain in certain situations when they're in public, for example, or giving a talk or a presentation. And we do find a lot of the really anxious kids we work with are high achievers, and nobody would ever realize it. But then they get home and they fall apart. Yeah.
The prevalence of anxiety is really quite high, and it seems to be getting higher. Is that true? Is that does the research actually show that it's going up?
Yeah, well, we think anxiety, different surveys, anywhere from 12 to 15 to even 20% of youth in this country suffer from anxiety that can interfere with their life. Post-pandemic surveys have come out suggesting that the rate has doubled. And some are showing that even 35 or even up to 40% of youth are responding to surveys with answers that would place their anxiety, again, at a level that is interfering or significantly distressing. It's really pretty alarming.
What do you think are some of the recent causes of that increase?
Well, that's a good question. There are a number of things, and certainly post-pandemic or since pandemic really triggered quite a bit of this increase. But even before that, I think one is increasing awareness. People are more aware, open to talking about their anxiety. The other thing is, and people always blame social media for everything, and I think social media is actually really good and helpful in terms of connection, as we heard earlier, and knowledge when used appropriately. But for most youth and many adults, probably most adults, it's being way overused. And it really is kind of the primary way in which individuals and teens interact with each other. And the problem is that information comes through social media in a way that's unbuffered. So again, when I was a kid, maybe when you were a kid, you know, if something bad happened, a disaster or something, it was filtered through our parents or our teachers. You know, young kids didn't get directly hit with this. It was provided in a context and explained in a way that reduced the impact. Now, kids are getting everything just straight on, like out of a fire hose. You know, you watch the news for 5 minutes or other types of things. There's also much more in terms of comparing oneself, you know, the ultimate ideals or the unattainable ideals that are being shown on social media. And we've all read about this. It really can impact people by saying, I fear missing out, I'm not as good as everybody else, you know, in terms of looks or smarts or accomplishments, and that can lead to anxiety as well. And finally, it's just, there's a lot of things for kids to worry about. The American Psychological Association does an annual Stress in America survey. And some of the recent surveys they had showed that young people were endorsing very high rates of concern about climate change, about bullying, about kidnapping, about suicide, about, you know, the shootings, school shootings, the negative, you know, immigration policies. Mm-hmm. And, you know, they're resonating to this stuff now in ways that they hadn't before. Mm-hmm. So I think there's just a lot of reasons. And then there's more pressure for school. Everybody needs to succeed to get into the best college.
I was actually going to touch on that.
Yeah.
I think, you know, we live in an achievement-oriented culture. So there's a lot of talk about being the best, getting into schools. You know, our teachers are talking about getting into schools. Mm-hmm. And even middle schoolers are having a hard time getting onto the basketball team.
Yeah. That's exactly right. And, you know, some people, some teens are just built for stress. You know, they really thrive on it. You know, you look at some of the athletes or people that perform at really high levels. For most of us, you know, some stress is good. I mean, we need stress and anxiety a little bit can really motivate us to do the things that we need to do. But there's so much stress now, and kids have bleaker views of the future. Mm-hmm. Which is really demoralizing, and that can lead to a lot of anxiety. What will the future hold in light of all of these various things that are going on around us?
Mm-hmm. Well, let's talk a little bit about treatment. We talked about cognitive behavioral therapy, mm-hmm. CBT is like used in every other sentence, but let's kind of get concrete a little bit. You know, what does treatment actually look like?
Well, that's a good question. You know, traditionally, treatment would be weekly. In our clinic at UCLA, you know, kids come in and teens come in for weekly sessions, 45 minutes to an hour. And the first step is to do a careful evaluation. So we'll do a diagnostic evaluation. We'll get an understanding of what other issues might be going on, what's family life like, school, social, et cetera, and get a history of the symptoms to make sure that we're dealing with anxiety, that anxiety is the primary symptom, and we can have a better understanding of that. And then in most cases, we start with cognitive behavior therapy. It's the treatment of choice. It's been studied, you know, much more data on its efficacy compared to other treatments, although we do use some components of other treatments. I can get to that in a minute. And the first thing is psychoeducation. I had said earlier that, you know, we're asking kids, our patients of any age, to let's make a list of all the things that really make you afraid, and then let's go find all of those things and do it. So that's a big ask. So it's hard to do that without some preparatory work. So we start with some psychoeducation, explaining anxiety, how anxiety works. I can sit with the child, as can you, and we can describe to them what they're experiencing, what they're going through, really almost without even talking to them, because you can understand anxiety. It's relatively straightforward in many ways to see why kids are reacting the way that they are. We have to do the same thing for parents, because parents don't always understand what's going on with their kids. And then the next thing we want to do is we want to break down, as I said, anxiety into the thoughts, the feelings, and the behaviors. And we spend maybe a couple of weeks talking about what are the physical feelings you have when you feel anxious? How do they interfere? And teaching strategies, again, like breathing, mindfulness, progressive muscle relaxation, contracting and relaxing your muscles can be very helpful. There are a number of other techniques. One of my favorites is something called butterfly breath. And butterfly breath, we can all do this here very easily. Open your palm like this, and you're going to draw, imagine there's a butterfly on your hand. And I want you to breathe in, out for 4 seconds and trace one wing of the butterfly. Now breathe out as you trace the other wing, about 4 or 5 seconds. And just focus on your finger, breathe in and breathe out. And if you do that 3 or 4 times, it's pretty calming. There are other types of breathing exercises that we do. There are a lot of, no shortage of techniques for managing the physical feelings. And as we learn to manage the physical feelings, for many people, the initial thought of anxiety, you see a dog coming at you, or you see a strange person on the street, or the teacher says, "Who could raise your hands? I'm going to call on somebody to get the answer to this question." The initial reaction is usually a physical feeling. It's like, "Ugh," and that physical feeling then triggers us to start thinking about negatives. So if we can get our physical symptoms under control and relax, oftentimes that helps quiet the thoughts. But the next step would be to identify what are the things that you're worried about, making a list. What really triggers your anxiety? What are you afraid is going to happen? And we can talk through these thoughts, and we can say, let's see, does this seem realistic? Do you really think this is going to happen? And try to get a better understanding of how the way we feel physically leads to the way we think. Conversely, sometimes the thoughts come first. Oh my God, I forgot to study for this test. Now I'm going to have a panic attack. Sometimes the thoughts come first. If we can get a handle on our thoughts, that can quiet our physical reactions. So those are the thoughts and the feelings. And then finally, I talked about exposure, as you did too. That is test. Let's see if these thoughts are going to come true. You're afraid that if you have to stand up in front of the class and do a book report, you're afraid that you're going to have a panic attack. Or you're afraid that people are going to laugh at you. These are what we call testable hypotheses, right? There are answers to these. We can see, if you get up there, we will find out if your thought is going to come true or not. And it rarely comes true. But in the midst of the anxiety, we avoid, because we think it might come true. So we actually gradually have our patients do the things they're afraid of, starting with very simple things, and then gradually working up to more difficult things, all the while practicing their techniques. And over time, patients, kids, teens, they learn, yeah, I'm worried about this stuff, but I know it's probably not going to happen because it hasn't happened yet. And then it's a matter of learning how to talk back to your anxiety, to manage these thoughts without having to give in to them. We don't make the anxiety go away. We can't really make anxiety go away. We can't really change thoughts, tell you to not think something. If I tell you all right now, and this is a very famous psychology experiment, I think from Berkeley, I don't want any of you, under no circumstances, all think about white bears right now. How many of you are thinking about white bears right now? Yeah, because you can't do that. So we can teach management. I know I'm feeling anxious, but I know nothing bad is going to happen, and I'm just going to get through my day and do the things that are important for me. So that's kind of a long answer, but that's what it looks like. And then we work with parents, as we've talked about. I won't go into that detail unless we have time.
Well, that was my next question.
Okay.
I mean, I know from personal experience that anxious kids and teenagers have anxious parents. Mm-hmm. And when you describe this treatment to parents, like, we're going to do exposure therapy and we're going to expose your child to the uncomfortable thing and the thing that they've been avoiding for a really long time, the anxiety of parents goes up as well. So how do you deal with parents' anxiety, and what's the role of the parent in the treatment process?
I also have a little family experience with parental anxiety related to child anxiety. Most kids with anxiety have parents that have anxiety. Not everyone, but it does kind of run in families.
It does, yeah.
And a lot of kids may learn from watching their parents to anticipate things happening. It's like, don't, do what I say, not what I do, or do what I do, not what I say. Mm-hmm. Parents may say, you need to do this, but in reality, the parent might be anxious as well. So that's modeling of anxiety, and that's we know that anxiety is biologically transmitted, genetically transmitted through generations, but there's also a very strong modeling. If our parents are acting in an anxious or avoidant way, the kids are more likely to have anxiety as well. So we kind of do the same thing with parents. We have to educate parents. We have to help parents understand about anxiety, why their child is acting the way they are, why the parent may be acting the way that they are as well. We want to normalize it. It's a normal reaction. If we didn't have anxiety, and I use this story with kids, I say, so you're a cave person. You're living in the wherever, a prehistoric person, and you hear a twig break. Now, you have two choices. You can say, oh, it's probably nothing, and keep walking, or you can say, that might be a saber-toothed tiger near me that stepped on a twig. I better run away. So most of the time you're going to be wrong, you're going to be right, but if you actually miss it, and it is a saber-toothed tiger, you're going to get eaten. So our brains are wired to respond to fear. Fear is much more powerful than reward. So when our parent is anxious about a child, that's biologically driven. We are wired to take care of each other, to take care of our children. So parents' anxiety oftentimes can be normal in wanting to protect their child, but if it goes overboard, it can actually be damaging by doing,
Can you
increasing
talk
anxiety.
about like this kind of like specifics in how it can, like examples of how it could be damaging?
Yeah, well, because a child that doesn't want to go to school, and we see a lot of kids like this in clinic. I actually, in self-disclosure, since Mark was so effective with that, I used to hate doing book reports. Whenever I had to do an oral report, I would pretend like I was sick. And I go, oh, I don't feel well. And my mom, I don't know if she knew or not, but she said, okay, you can stay home. I think she was just a really nice mom. She knew I was faking it, but I was faking it. And every time I did that, the next time there was a book report, I was even more afraid because I hadn't done any of them. And it just in my mind kept building up and building up. So that's the accommodation we were talking about, is parents want to do the right thing. And what parent wants to see their child suffer? And what anxious parent thinks their child is actually something bad will happen? So we're kind of programmed to give in to the anxiety. And over time, again, that can make things more difficult because kids don't have the opportunity to really learn that they can handle these things. We don't have an opportunity to learn how strong we really are, both as kids and as parents. So that's the thing we need to really address in treatment, is giving parents the tools and the confidence to really, push their kids to do the things that kids don't want to do, and give the kids the skills and the confidence so that they actually can do these things. But we start low. We do little steps at a time. As I was saying in the breakout, we don't teach kids to swim anymore by throwing them in the lake. We start with like water wings and the shallow end and gradually work to the deep end. And that's exactly the way that treatment works.
Yeah. Aside from structured CBT, are there any other options, strategies, anything else that can be done if that's not available?
Yes, there are online treatments. There are self-help books for parents. There are self-help books for teens. They're using mindfulness and other types of strategies. There are a lot of really great strategies out there. Cognitive behavior therapy with exposure, again, moving from the shallow end of the pool to the deep end of the pool, really is the most effective because it's been used. But as many of you may know, there's a huge shortage of mental health providers. We, about 6 months ago, we had almost 300 families on our waiting list waiting for treatment. It's down to about 150 now. There is nowhere near enough kind of clinic treatment capacity to help all the people that need it, kids or adults. So we need to be more creative. So there are online programs. There are, we have a center, our CARES Center at UCLA, carescenter.ucla.edu. We have a number of strategies and handouts and things that can be used to help manage anxiety or educational things. But meditation is great, mindfulness strategies. The three most important things are diet, sleep, and exercise. These are magical things that can really help. It may not make your anxiety go away, but kids that don't get enough sleep, that don't have the right diet, and that don't exercise are much higher risk for these disorders. It doesn't cause anxiety disorder or depression, but it really can exacerbate it because we don't have the internal wherewithal. Our motors, we're not efficient enough to really manage these things. The other things that can be helpful are just trying to get out and do things, being active. One of the issues with society today is the rates of anxiety in kids are increasing, but parents are no less. It's increasing for parents too. The pandemic was horrible for parents. And seeing the education, the kids not getting the educations, also being isolated and trapped, maybe impacting their work or their education or financial matters. You look around, so parents are anxious as well, and people tend to stay in, but we want to get out. We want kids to be as active as possible, facing their fears, strong sense of connection, being in clubs or connected in other ways can be really important to the level that a child or teen's anxiety will allow it. A very anxious kid, we don't want to dump them off into a club with no tools because they're going to be really triggered. If I'm afraid, have no confidence, and I'm afraid I'm going to be teased socially, and I'm signed up for a club and thrown in without any support or help, it's probably going to be a disaster. But again, if we can use these techniques to develop some resilience and some skill, confidence, then we want to really push our teens out and our kids out into society and get them connected and keep them active.
Mm-hmm. I'm glad that you said that. COVID gave us a lot of good tools, but also gave us a lot of online, internet, social media use, which decreased our social skills across the board, and then made us socially kind of awkward, and then social anxiety really, really increased.
Yeah, that's exactly right. I'm sure you see this in your practice and the way that we see it. So in some ways, we're doing less, adults, but kids are doing less as well. There are statistics out, national statistics. The number of teens that got their driver's license is probably half of what it used to be. The number of kids that report going out on a date, or I forgot some of the other things that they're doing, having a job outside of school. These signs of independence, signs of transitioning. I'm working, I'm in clubs, I'm developing, the kinds of skills and things that I need to do in life that our generation or prior generations did. That's not happening.
And even, I get this a lot, aside from COVID and social media, parents are doing too much, like their laundry, those kind of independent tasks, because they want to preserve their achievement.
Yeah.
So, you have all this homework to do, and you have this club to go to, so I'll do all of your chores for you.
Exactly. And if a teen or a kid gets a bad grade on a test, what happens? Is the child encouraged to study more, or does the parent call the school and argue that it's a bad teacher or it wasn't fair? Because the pressure is so high that you all are getting robbed in some ways of the stuff that we did. It's messy. Growing up is messy. And it's hard, but it's fun and exhilarating. And when you do it, you have a sense of accomplishment that is really amazing. You all here are accomplishing these things because you're here. You're in the AIM Youth Advisors. I mean, what an incredible accomplishment. It's amazing. But so many kids are not doing things like this because of anxiety or because of pressure to do other things. And they're missing out. And as they become adults, they're not going to have the skills to manage society because they didn't practice as teens.
Right.
And the anxiety rates are going to go even higher.
You know, medications is something that we're asked about all the time. When, like, ideally, do you consider adding medications to the treatment process? And is there any danger in going the medication route first instead of treatment?
Well, we consider the skills building, again, the CBT or the ACT or DBT, or, you know, there's a lot of different treatments, family, you know, based treatments, you know, for anxiety and as well. It's all really important. Medication can be very helpful, but you're not learning the skills that you need, all the things that we've been talking about. So hi Elmo. We use a fair amount of medication. We like to start with CBT, and if it doesn't, we're not seeing gains after maybe 6 weeks or so that we'd like to see, we'll add medication, and we'll do that, you know, we'll do that with confidence. We rarely do medication without CBT because, again, you may feel less anxious now, but when the medication stops, chances are that your anxiety will come back because you haven't learned the techniques. If a child is not in school, if the child is too anxious to come into clinic, if we're talking about doing exposures and the tools, the child is so anxious that they can't manage to do the treatment and engage, we would consider starting with medication and let that kick in a little bit. Kids with ADHD, we oftentimes want to try to get the ADHD under control first. Kids with depression and anxiety, it depends. If they're depressed because they're anxious, oh, I'm depressed because my anxiety keeps me from doing things, we would say that anxiety is primary. If we treat the anxiety, the child's depression should lift. If they say, I'm really depressed and I don't have the energy, or I don't really care about treating my anxiety because I have no energy and it doesn't matter, we would consider the depression primary, and we'd want to treat the depression first, or start depression treatment and then add anxiety treatment. The medications work, the anxiety medications work the same for depression, so a child with depression and anxiety, we might start with medication so they would have a little more energy, a little more motivation, and maybe reduce the anxiety so they could do better in therapy.
To wrap up, if anybody wants to learn more about anxiety and treatments and where to go, what websites or kind of associations would you guide them towards?
Well, our CARES Center website that I think is really helpful. It's focused on anxiety. ADAA.org, Anxiety and Depression Association of America, is a national organization that is really, really fantastic. ABCT.org, Association of Behavioral and Cognitive Therapists. If you're looking for a therapist, they have a lot of information there. I think these are all quite important. Child Mind has a great website. They have a presence in the Bay Area, I know. There's another website called infoaboutkids.org. I helped develop this. It was developed by all of the child divisions of the American Psychological Association, like family psychology, child psychology, pediatric psychology. We put together that resource. So there are a lot of resources out there. It's important to look for evidence-based treatments. If it sounds too good to be true, if the treatment doesn't contain any of the elements that we've been talking about, it may not be evidence-based. So that's important because these treatments have been proven. And then using things like acceptance and commitment therapy, we use a lot of values kind of focused, work in our treatment in CBT. We do mindfulness, as I said, acceptance sometimes. There's a lot of elements you can add on. Social skills training, for kids that are less comfortable about their social skills. So you can certainly augment CBT with any number of strategies.
Mm-hmm. Great. Thank you, Dr. Piacentini.
Thank you. It was great doing this with you. Yeah. Good.